everybody out there. Good morning. My name's John Harlow, and I'm here with Betsy Richard from Somerset Public Health.
Yes.
And what's your title?
So I am the care coordinator for substance use disorder at Somerset Public Health through a grant that we have recently received called First Response to Recovery.
Okay, and that's what brings us here today.
It is.
So this is a relatively new program.
Yep.
And you're our neighbor here at Old Point Avenue.
Yes.
And so tell us a little bit about this program and what you have to offer folks in the community.
Sure. So the program is actually made up of like 4 different parts. One part is I am embedded in the Somerset County Sheriff's Office. Okay. So I am able to do a follow-up response for substance-related calls. So if a deputy goes to a residence for something that's substance-related and the folks there want some help and support for treatment and recovery, then they make a referral to me, and then I reach out and get them connected to whatever they need. So that's one part of it. The other part, or another part, being here as your neighbor, we have opened up what we're calling community connection centers. So we have one here in Madison, and then we have one in Bingham, and those are drop-in locations where folks can come in and get connected to any community resources, or we can make connections to them for substance-related treatment and recovery resources as well. And we have harm reduction supplies. So folks can come in if they need Narcan, and we can give them Narcan. We have wound care kits. We have some fentanyl test strips. So folks can test their substances if they want to.
This is based out of the Old Point Avenue School in Madison. And where's the office in Bingham?
So our space in Bingham is at 356 Main Street. If you're headed north through Bingham, it used to be the very old health center, and then it used to be the information center. But it's a white house right before you cross the bridge with Dollar General on the other side. Okay.
And so do you have to live in that community so anybody in the general area, Athens, Madison, Skowhegan, Cornville, this area, you can stop in, and you mentioned you can get harm reduction supplies, things like Narcan, and what's the wound?
So wound care kits, it's really like a little mini first aid kit.
Yep.
We have learned that part of the drug supply, the illicit drug supply around Somerset County, and really it's in the state of Maine, is this substance called xylazine. And xylazine actually causes wounds that people may not necessarily know how they got them.
And the common or the street name is Trank.
Is Trank, yes. Yep. So we have wound care kits so folks are able to start caring for these wounds. At some point they would need to have medical intervention because they can get pretty bad. Yep. So, so we have wound care kits to give folks.
And so these are all part of an effort statewide and countywide to reduce the stigma of people who are seeking treatment or seeking help. And it's also for family members of those people as well.
Absolutely. Yes. Yes. We know that substance use disorder and addictions impact the whole family. So it's not just a singular person disease, issue, condition. It really is, it impacts the family unit. So anybody that just even wants help or resources for their loved one, they can come in and talk to us.
What kind of resources would family be receiving?
So we have information on support groups. There is a support group. It's actually the only one in the state of Maine, and it's located here in Madison. It's on Monday night. It's called PALS, which stands for Parents of Addicted Loved Ones. So we can help get folks connected to that support group. There's an NA meeting that has started in Madison, so we can also help folks get connected to that. There is some other recovery or family support stuff that is offered through Kennebec Behavioral Health, so we're able to get folks connected to those services as well.
Yeah. So how connected are these different agencies and counties? Are you all working together? And because you had mentioned that you're working now with the Sheriff's Department, Somerset Sheriff's Department, and that seems like a big step in just having the communication between everybody who has the same kind of common goal.
Yeah, absolutely. So prior to us getting this work, we have had 4 years of building relationships with a consortium of providers around Somerset County. So it was Reddington Fairview General Hospital, Somerset Public Health, Kennebec Behavioral Health, Kennebec Valley Community Action Program, so KVCAP, the Sheriff's Department, and Scout PD, and Health Reach. Yep. So those are the agencies that we all came together, and we've been working fairly closely for the last 4 years with building some connections to treatment and communications and making sure that historically mental health and substance use treatment were all done in silos around the county. So doing this consortium model, we were really able to break down a lot of those walls and get folks working outside of their silos, all for the greater good of helping folks with substance use disorder get connected to treatment and to reduce that stigma and the judgment that goes along with it.
Well, that sounds great. So is there anything else that we should know about or that you would like, for the public to know?
Absolutely. So I said that, we were kind of working on 4 components. So 2 of the other pieces that we're working on and, any help and support from the communities would be fantastic. One is creating a county-wide alert system. So when there are lethal drugs that are here, so it's a bad supply or whatnot within the county, that we'll be able to get an alert out so folks know, if you happen to get your drugs from, this particular community, there's been a lot of overdose, just be careful, use slower, we can get the messaging out just to make sure people are safe. Yep. And family members are also aware of their loved ones that may be using substances that, wow, okay, so this could be a really bad batch.
Yeah. And by bad batch, you mean somebody who is experienced with using these illicit drugs but they buy a drug and it's more powerful than they're used to, or it contains these other substances that increase the risk of overdose.
Absolutely. And there's even now there's substances that people may want to have something different. And so they're looking for a particular substance, and they buy that particular substance. But it could have a lethal amount of fentanyl in it that they didn't know was in it. Right. So just making sure that those messages are getting out. Yeah. So that's part of what we want to do in terms of just notifying the community. And then the other piece is working within communities to help break down that stigma. Yeah. And getting just information and education out in this grant, because we have a community connection center in Madison and Bingham. We have some specific work focused on those 2 communities. Yep. So one of them is just holding community forums. Yeah. And getting folks to come out so we can just start having the conversation about substance use and its impacts on folks.
Yeah, and I think that's a good piece to include because, as you stated before, it's not just the individual that's using, their family, and it even extends to friends.
Absolutely.
People who know somebody that's struggling from addiction or knowing somebody who's died from addiction can be a traumatic thing that people have to talk about.
Yes. And
doing it in private, I guess, we've tried that and it's not working. So, I commend you guys for trying something else and putting it out there, because it's here. It's been here for a while, and we got to try to do something.
Right. Yes. We are also planning on doing some open houses as well.
Yeah.
So community members can come in and, when people come into a place for the first time, they often have some fear of the unknown. What's it going to be like? What am I going to be met with? What can I expect? So we want to do an open house here and an open house in Bingham, so community members can just come in. No, they don't have to have a reason to come in except just to check it out. And honestly, any day. So we're here on Thursdays.
That's a good thing to mention. Here on Thursdays for anybody to come.
Yep. We're here from 1 to 4. And then in Bingham, we're there on Fridays from 12 to 4. Yep. And if we find that if those hours don't really work for folks, then we have the ability to kind of mix them up, which is fantastic. Or if we need to be here more frequently, we can do that as well.
Yep.
But that's also where the public can come in and, give us some feedback. Hey, I'd love to see your services. However, I can't do it on this day. This would be better. Yeah. So we have some options available to us.
Yeah.
Yes. And the other thing too, I'd like to say, is that, so we're not only doing this as just us. So you had asked earlier about other community partners that we're working alongside. The state has rolled out a couple of years ago a program called Options, which is an acronym for a lot of other words.
It's a long acronym.
It's like overdose prevention through in something IONS. Yeah. So we have an options liaison for Somerset County. Our options liaison works for Sweetser. So he is with me as well at both of the community connection centers.
Yep.
So Keith is able to do some different work than what I am able to do through the grant, which is nice.
Yep.
So we have partnered with them on this work, and there's also so we have an options liaison as well that's here at the Community Connection Center.
Great.
Yeah.
Yeah. So just kind of wrapping it up, I guess, unless there's anything else.
I don't think there's anything else. If people are interested, I try to do a live Facebook feed. So follow us on Facebook at Somerset Public Health.
Yep.
That's always a good place, and to be able to get information about what's going on and our community connection centers. But it's a good resource for folks.
Yeah, and so quickly running back over. You're both here on Thursdays from 1 to 4 for anybody in the surrounding towns to come and just talk or get resources, whether that's being put in connection with a recovery program, or getting supplies to reduce the risk of overdose.
Yes.
Working with the Sheriff's Department, I think, is a really big step for giving people the option that there is treatment available.
Right.
And it's definitely a difficult thing to have to deal with, but there are people out there willing to help.
Definitely. And it's important for folks to understand that treatment is available.
Yep.
And, recovery is possible. It happens every day for folks.
Yep.
Yeah.
Great.
Yep.
Okay, so, we hope to continue this conversation in some ways, and maybe check back in and see how things are going with you, and talk with different people who are connected to this work. And we just thank you for being here and being at Old Point.
Well, thank you for having us.